Good morning, everyone. My name is Tariq Salam. I'm one of the third-year Pulmonary and Critical Care Fellows.
And I'm Claire Ronan. I'm also a third-year Pulmonary and Critical Care Fellow at Brown.
We're going to talk about our program today. So our program director is James Simmons, and our associate program directors are Jisoo Lee and Rachel Darling.
So an overview of this presentation is we're going to talk a little bit about the different hospitals that we rotate at, and there will be a brief discussion of our rotations. We'll discuss the conferences and educational opportunities here at Brown, and then a little bit about Providence and Rhode Island, where you might be living in the future.
Now, starting with the hospitals that we rotate at. So we rotate at 3 hospitals primarily. The one where you'll spend the majority of your time is Rhode Island Hospital. It's a large tertiary care center. It's a level 1 trauma and burn center, and it's a pulmonary hypertension center. We have 2 medical ICU units. So we have the medical ICU and the respiratory ICU. And then we also have a neuro ICU, a cardiothoracic ICU, a CCU, a trauma ICU, and a surgical ICU. At Rhode Island Hospital, we do our inpatient pulmonary consults. It's one of the 2 sites for our outpatient clinics. So we do pulmonary and sleep clinics at Rhode Island Hospital. And then we rotate through the medical ICU and the respiratory ICU as well.
The second hospital that we rotated is the Miriam Hospital, which is a smaller community setting. It's a 250-bed tertiary care level 2 trauma center. It's on the east side of Providence near Brown University, and it won a Beacon Award for excellence in ICU. The rotations that we do there are inpatient pulmonary consults, and then there's a mixed medical, surgical, some neurologic ICU at the Miriam Hospital.
Now, the third hospital is the Providence VA Medical Center. So it's a smaller hospital. It's about 80 beds, and it's the main VA campus for Rhode Island patients and the Cape. There, we rotate for 3 months during our first year. We do inpatient pulmonary consults there. We spend some time in the ICU there, which is a mixed medical and surgical ICU on the smaller side. And then we also spend a lot of time on the outpatient side at the Providence VA. So there we do one of our 2 sites for the continuity clinic. So we do pulmonary clinics there, and we also have lung nodule and cancer clinics as well. And there's a lot of emphasis during our time at the VA on pulmonary physiology. So there we learn how to interpret PFTs, cardiopulmonary exercise testing, and sleep studies.
So now we'll talk a little bit about the various units at the different hospitals. So at Rhode Island Hospital, there's a MICU, which is an 18-bed ICU that's split into 2 different teams. There's a south side and a west side. It's a high acuity and referral center, and there's a built-in ICU teaching curriculum throughout the time that you're there. Pictured here is Dr. Aliota, who's the head of the ICU at Rhode Island Hospital.
Now, one of the special things about our MICU is that we get exposure to ECMO in our medical ICU. It's an ECMO center of excellence, and we see veno-venous and veno-arterial ECMO cannulations in our unit. We collaborate with cardiothoracic surgery for cannulation, but we're primarily on these patients after they cannulated, and they stay in our medical ICU. We get about 15 to 20 plus runs on adults per year, which means that at any rotation, you get some exposure to ECMO. During our time, we learn how to troubleshoot ECMO. So hopefully by the end of the 3 years, you'll be comfortable managing ECMO patients.
Another unit at Rhode Island Hospital is the respiratory ICU, or the RICU. So it's a 10 to 18 bed step down and specialty ICU combo unit. And it's staffed with hospitalists who are overseen by a pulmonary and ICU attending. We learn a lot about pulmonary hypertension here. We see a lot of initial medication starts for pulmonary hypertension in this unit. There are chronic vent management, and then it's also step down care for patients who are coming out of the ICU or don't necessarily need full ICU level of care.
And then the third ICU we rotate at is the Miriam Hospital ICU. So as Claire mentioned, the Miriam Hospital is more of a community setting. So we get community ICU exposure at the Miriam. So it's a mixed ICU. We see medical ICU, surgical ICU, neuro ICU, and cardiac ICU patients at the Miriam.
And one of the cool things about it too is that it's actually a mixed team from internal medicine, family medicine, anesthesia, and then interventional radiology. And on the slide here is pictured Dr. Farino, who's the head of the medical ICU at the Miriam Hospital.
Now, in terms of the schedule, so the first year is pulmonary heavy. We spend the majority of our time in our first year focusing more on pulmonary than ICU. So at Rhode Island Hospital, we do 2 to 3 months of pulmonary consults. We do 1 month in the respiratory ICU. And towards the end of the year, we do a block of medical ICU nights. At the Miriam, we do 2 to 3 months of pulmonary consults. At the VA, it's a 3-month rotation where you get exposure to pulmonary, ICU, and outpatient pulmonary as well. And then we have 2 dedicated blocks during first year for outpatient pulmonary. So during these 2 months, we rotate through attending clinics. So we get exposure in subspecialty pulmonary clinics like pulmonary hypertension, interstitial lung disease, lung nodule clinic, cystic fibrosis clinic, diaphragm clinic. And then we do our weekly right heart catheterization with the pulmonary hypertension attendings on their pulmonary hypertension outpatients as well.
And this is just an example of the block schedule and what it would look like throughout your 3 years. You can see here at the top are listed the first year fellows, and then the second year fellows, and then the third year fellows, along with the critical care fellows who rotate with us. As Tarek mentioned, the first year is really pulmonary heavy, and then the second year is critical care heavy, and there's a mix during third year of pulmonary and critical care, as well as your research time.
Now, during second year, the first 6 months are clinical. So we do 2 months in the medical ICU. We spend 2 blocks doing night float in the medical ICU as well. We do 1 month of non-medical ICU time. So that can be neuro ICU, CT ICU, SICU, TICU, or CCU. And we have 2 dedicated research blocks in the first 6 months of second year, just so you can get your project started, get started on your IRB before you start your research year after that. In the last 6 months of second year are dedicated research time. So January through the end of the same academic year is your dedicated research year. During the first 6 months, you get a month of pulmonary consults.
And then finally, for the third year, the first 6 months are the end of your research block. So that will get a full year once you do the 6 months in second year and the 6 months in third year. It's protected time from July to January. And you do have a single month of RICU and pulmonary consults during that period of time. You have a fall research presentation that you give, and then there are protected conference attendance. Often third years are going to ATS and presenting their work during the spring of their third year. The second 6 months are clinical, and it's kind of a mix of pulmonary and MICU. As you can see, there's 1 month of pulmonary consults, 1 month of MICU, and then there are 4 weeks of nights, as well as 1 month of RICU and 1 month of research. And this was really to get people more experience or have the final months of their fellowship be clinical heavy, so they're ready to go out and start their jobs as attendings.
Now, during the research year, as we mentioned earlier, we have a full year dedicated to research. You start working on your research during your research blocks before the first 18 months end, so that by the end of these 18 months, you had already submitted your IRB and your project is approved, so you can get started immediately as you finish your clinical time for the first 18 months. Fellows at the end of the research year are expected to submit an abstract to a national meeting. Typically, because of the timeline, ATS works out, and it is the conference that most fellows submit their research to, and you present your work at that meeting at the end of your third year. And if a fellow is interested, they're encouraged to apply for a T32 grant. And people have had their work submitted to different journals, as you can see here.
There are also clinic experience. So we've touched a little bit about how there during the first year, there are 2 months of protected outpatient clinic experience built into your first year schedule. There's also continuity clinic once a week that occurs in 2 different locations. So there's one at Rhode Island Hospital in the co-op pulmonary clinics, and there's one in the VA pulmonary clinic. Often you alternate weeks doing these individual clinics, and they're different patient populations. So the Rhode Island co-op pulmonary clinic is typically patients that were seen after hospitalization and following through their time after we see them on pulmonary consults in Rhode Island Hospital, whereas the VA is the veteran population, which is a special population that you get to build a kind of relationship with out through your 3 years. There's also a new outpatient mentorship program to provide management and guidance and career advice that you're matched up with one of the pulmonary attendings, and you can talk to them about your outpatient experience and also any patients that you have questions about in between the clinic sessions that you have. Further outpatient experience is also encouraged, and you can do during your research here, going to the subspecialty clinics of your choice that are the attending clinics like ILD, pulmonary hypertension, that are at a separate location from Rhode Island Hospital.
Now, in terms of conferences, so we have a summer lecture series that runs over the first 2 months of fellowship, going over basic pulmonary and critical care topics. We have a protected ultrasound course that we go to in the first few months of fellowship, and it's 2 days and it happens at Tufts. We have thoracic tumor board. We have a board review that starts later in the year after the summer lecture series is over. We have ICU combined conferences with the cardiology department, the surgery department, and the emergency medicine department, where we discuss shared cases. Then we have our own grand rounds every Friday, where every week a fellow and an attending present on a topic of their choice.
And to continue some of the education and conference experiences, we have a monthly journal club where 2 fellows present journal articles, one from pulmonary, one from critical care. There's radiology case conference, which is pictured here actually, and it's one of the highlights of our conferences. A thoracic radiologist helps walk us through cases that we find on the pulmonary consult service and talks about diagnosis as well as management of these patients. There's research conferences where we're presenting our own research and presentations, and then we're also having outside presenters present their research. There's ILD conference that happens monthly in collaboration with pathology and rheumatology to talk about specific ILD cases and how to manage them and diagnose them. There's VA physiology conference that happens every Friday. And then there's a medical M&M and an ECMO M&M. And there's ultrasound conference as well. So now a little bit about Rhode Island, the ocean state, a place you might be living for the next 3 years. So Rhode Island, the Providence area. The Providence area is about 200,000 people with 1.6 million people in the state of Rhode Island. Compared to the surrounding cities and states, there's a reasonable cost of living. And there are multiple universities here in Providence, including Brown, RISD, URI, Johnson & Wales. There's easy access to Boston. It's about 45 minutes to an hour driving to Boston. And there are also trains that are available almost hourly to go up to Boston. And then there's easy access to New York as well. There's a small airport here, TF Green, for that is a Southwest Airlines hub. And then there's also, you can easily get to Logan Airport, which is a larger hub in Boston.
Now, since it's the ocean state, there are a lot of activities in the spring and the summer. A lot of people here sail and surf and do a lot of water activities. And the food scene here is really good.
And like a lot of other New England cities and states, there are great opportunities and things to do during the fall and winter, including various festivals, apple picking, and then opportunities to ski and skate if that's something that you're interested in, and a lot of outdoor activities actually to do throughout the winter.
Providence also.
Okay, other things to do in Rhode Island. There is a pretty good art scene here. So you can see here, Providence Performance Arts Center is pictured. And then there are other ways to explore the art scene throughout the city, including the RISD Art Museum. There's also a variety of minor league sports teams. Here is pictured the Providence Bruins, and then there are major sports teams that you can access by going to Boston.
I hope we've convinced you so far that Providence is a cool place to live. But if not, it's been listed on multiple websites as one of the top cities to.
So Providence is ranked top 5 in theaters, galleries, arts, bars, a variety of foods, which makes it a really excellent place to live. So we're really happy that you took the time to learn about the Brown Pulmonary Critical Care Fellowship with us. These are some of the fellows throughout the years who all have become great friends, and we're hoping to see you here in the future.